Hey, deserving listeners. Today I want to talk about problematic terms in psychology. The spark for this episode was that someone emailed in telling us to not use the term Asperger's. And I think what happened, the email was addressed to Bob and to me. And I think from my memory, Bob in an episode used the term Asperger's. It could have been me that used the term, but I'm not sure. Or we read an email that used the term. The reason why I don't think it was me is because over 10 years ago, the field of psychology decided to use the term autism spectrum for a variety of reasons. And I believe that I've been using that terminology ever since. I can see myself using the term Asperger's with someone on the autism spectrum who identifies as being Asperger's. I will talk to people like that. Like if I had a client, for example, I wouldn't correct them, right, if that's how they self-identify. Or some experts still use that term. The reason why we don't want to use the term Asperger's is because there was a Nazi physician by the name of Asperger who was responsible for imprisoning and killing many, many people who we believe were probably on the autism spectrum during World War II and before World War II. So obviously, referring to these individuals with that name is problematic, hurtful, offensive, right? So this all started when I was preparing for tomorrow. I'm going to be recording a podcast with Bob, and I was going over emails to possibly read on the air, and I came across this email because it was addressed to Bob and me. That's why I think it might have been one of us or Bob. I don't know. But I was going over this email and thinking about how to respond. But as I went down a mini rabbit hole, I realized that the topic was bigger than just a short section of an episode with Bob. I started thinking about all the various different considerations and other terms as well, like histrionic or mental retardation, and also just other terms in our culture, like African American or Oriental, for that matter. As an Asian American, my grandma would still call herself Oriental. I started thinking about all these terms, and I started thinking about how do we move forward for social justice, for empathy, but also how do we evaluate which ones are worth changing, which ones have enough problematic nature to it that require or suggest that we should change them. Because there are some terms, case-by-case basis, that have problematic origins, but they aren't considered that problematic today. Maybe they will be in the future. I don't know. Maybe all of our terms will consider to be problematic in the future. And that's another thing that I wanted to think about personally, and I guess write in my notes and make an episode about, was as an older person, I have seen changes in terms, whether it's in psychology or in ethnicity or sexual orientation. I feel like as an older person, it might be part of my role to provide at least my memory of the cultural changes so that the history of it can be elucidated on in some way. Because there are ways in which we will look back on history and think, oh, that person is racist because they use that term. And maybe they were, but not necessarily is the thing. And so part of it is just self-preservation, because I've been recording this podcast for 17 years, almost 17 years. And sometimes when I'm listening to a rerun, I will cringe at a word that I used, but then I have to remind myself that that was the preferred term back then. The other thing is that as a society, we have a racist society. We have a bigoted society in a variety of ways: heterosexist, homophobic, transphobic. All sorts of bigotry exists, and of course our terminology reflects that often, and that's why we want to change things. But at some point with some terms, I, at least today, will advocate for more careful consideration as to whether or not we change it. And that's what I want to talk about a little bit today. So to wrap up the Asian Oriental terminology thing, I just want to say that I'm not advocating to returning to the use of the term, but to give you a very brief history of the term Oriental and Asian, with Oriental, from my understanding, the Orient meaning that it's the East. So you had white European people referring to people in what we would call East Asia as being from the Orient, so they would say Oriental. So it's basically Easterly person. But when we start thinking about Asian, well, what is that? Well, it's based on Asia. Okay, well, where do you get that word? Well, that word Asia is the name that we have historically called that area of the world, right? The continent of Asia. Where does that word come from? Well, that word comes from ancient white people in Europe who referred to a region in Turkey as Asia because they hadn't explored themselves beyond that. Now, there were humans beyond that had explored and had maps, but to Europeans, 2,000, 3,000 years ago, they didn't know that. So they, in their way, referred to the East, to Turkey, and a little bit of, a portion of it as Asia. Then, and on maps, it would just be like Asia is over there. And there were other names, over time and different names in different cultures, even in Europe. But then as the white people and others started to expand their maps, they just started to say, well, it's all Asia. And for, not only just this region in Turkey, but the entire country of Turkey, and then everything that direction is Asia, all the way to Japan, right? So that word Asia or Asian is very similar to the origin of the term Oriental. What I believe happened was that the term Oriental became a slur, became associated with racism and bigotry, and so a different word was adopted in the 50s and 60s, meaning, we started using the word Asian or just Chinese American, Japanese American, that kind of thing. So that's just a little jag on that. These aren't psychology terms, but I just thought I'd wrap that up to show kind of the nuances of this, right? Language, linguistics, history, bigotry, self-identification. How is the term being used? How is it used over time? But anyway, let's get into some psychology terms. But first, let's take a break. All right, back from the break. Actually, before going into some psychology terms, I wanted to talk about some other non-psychology terms, things that I just thought of as I was brainstorming other examples to use as a basis for understanding when and what terms in psychology to change. The first thing that popped into my head was recently the United States government finally listened by changing a lot of military forts in the south of the United States. A lot of the military forts like Fort Bragg, Fort Benning, Fort Lee were named after Confederate generals and or slave owners. There's still a lot of high schools that are named after slave owners, and not just slave owners, but like slave traders, slave advocates, right? So all the forts were changed. There were several, maybe 15 or 20 forts in the United States that were renamed in 2023 for good reasons. Like I just listed some other forts: Fort Benning, Fort Gordon, Fort Polk. These were all Confederate commanders who were openly talking and fighting in the Civil War for slavery. They loved slavery. They thought of black people as not entirely human or not human at all. And so it took all the way until 2023 for those stupid-ass names to change, and thank God that they did. There have been a lot of changes in mascots of high school. The high school that I went to, Issaquah High School, the mascot was Indians, the Issaquah Indians. They changed it to Eagles in the 90s, I believe, for obvious reasons. Also, there's still a lot of high schools all over the United States, particularly in the South, the Southeast United States, that are named after slave owners and Confederates. I just Googled it, and one of the things that came up is that there's still dozens of schools in Chicago alone that are named after problematic people. Like one of the schools identified was John Marshall High School, and the individual that is named after, John Marshall, he apparently owned over 200 slaves and was an advocate for that. I also thought about just even the term black, right? To be black. And I grew up in the 70s, 80s, and up until about the mid-90s using the term black. That's the way black people refer to themselves. That's the way it was talked about. That's the word that was in even textbooks, right? But in the mid-90s, when I was in graduate school to become a therapist, there was a movement, maybe just before that, maybe like around 1990, there was this movement to change the term to African American. I had known about other terms prior to that, right? Like colored people or people of color, like the NAACP is still using that term, National American Association of Colored People, I believe. There was a time when colored was a preferred term because the previous term was considered outdated or racist, right? Well, eventually the term colored becomes a problem because bigots use it as a weapon. And then people, at least partially because of that reason, will want to change it. So it was changed to black. I'm sure there's a lot of details here that I'm not aware of, but this is my memory of it anyway. And then in the 90s, there was a huge push to change it to African American. For example, in my cultural studies class in graduate school, that was taught by a black woman, by the way, she was the first to really formalize it to me and explain it. I can't remember exactly what was said, but from my memory was something along the lines of, look, our skin color isn't black. We're brown, one. Two, it is offensive to just identify us by our skin color. It'd be like calling Asian people yellows or something. So we should use a system or a format that other groups of people use, like Asian Americans or Native Americans. That was another term. Native American was from Indian, right? Because Indian, it's like, well, they're not from India. That's offensive. So you want to say Native American. And with black changing to African American, it was similar to Hispanic American, which, there's a lot of history and terminology here. But then, more recently, in the last 10 years, people have been starting to use the term black again. A lot of black people actually were saying, I don't like the term African American. Let's return to black. And this is just my cultural pocket or my awareness, is that pretty much all the black people I knew, professors, colleagues, friends, were very much on board with the African American shift. And it kind of made sense to me. That's why I started using terms like Caucasian American or European American instead of white or Caucasian. We can go down a whole road of where Caucasian, the Caucasus, and anyway. But it kind of made sense, right? You have Native Americans who were here native originally, and you have Asian Americans and African Americans and European Americans and Latino Americans and Canadian Americans and, or more specifically, Korean Americans or Romanian Americans, right? And so it all just kind of made sense to me, right? It didn't have any kind of baggage to it in my mind. And this is all just me in the 90s. And it was formalized, right? You didn't have some that were white or black, and then others that were Asian American, and then others that would just be Hispanic. It just kind of gave it. I like things being tidy. But anyway, so the African American thing, I went along with because that's, and I wasn't begrudging. I was like, okay. And when you listen to old episodes of this podcast, you will hear us using the term African American, and maybe at times still. But the black people around me started using the term black more often, and at my university, it started to be formalized. And then you would hear other kinds of terms like BIPOC or Anyway, we could go down a whole rabbit hole. But then the word colored started to be used with people of color in general, right? And when that terminology started being used, I don't know, 15 years ago or something, the first couple times I heard it, I was like, what? That's an offensive term. People of color? What we would say before would have been minorities, right? Or non-white people or something. People of color, okay. And then over time, with enough adaptation by me to the culture around me, eventually people of color, or me being a person of color, was not cringed at by me anymore. So I'm saying I'm on board with all of this. I think that the general cultural movements along these lines are positive. They are attempting to evaluate, attempting to be empathetic, attempting to recognize history and renew ourselves, cleanse ourselves to some extent, at least of our language, of problematic origins, right? But there's this other element to it that as bigots use our own terms that we are saying we want to use, and they use it so often, eventually the term, if we let it happen, the bigots will own that term. That's what the term black was in the 80s, was that bigots would use the term black as an attack, as a way to dehumanize and to otherize and to be racist. And it was so, the term black became, from my observation, so laced with that people were, I don't know. With Oriental, I think that's the history of that. What's really the difference between Oriental or Asian? It's both of them are basically from the white European perspective of East. Orient is Pacific East, right? But Asian is, like I said, it was originally just like that region of Turkey. It's a small region of Turkey that was Asia, and then eventually it's just like, well, that everything east of us is Asia, because we don't know what other name to give it. Now, overall, my point is that I support these changes for the most part, but some of the advocates of changing seem to me to be advocating just for change, or they are accommodating the bigots, which I'll get to in a second. But first, let's take a break. All right, we're back from the break. So before going into psychology terms, I just want to go over another little bit of my notes, because I find it fascinating and informative regarding the changing of words to look at non-psychology terms like LGBTQ, right? So I grew up with gay and queer being horrific slurs that even some bigots would never use. It was considered a horrific thing to say to someone, and the preferred term was homosexual. And to me, when I learned about that term, maybe I was a kid probably when I learned, there were heterosexuals and homosexuals, heterosexual person and a homosexual person. And to me, that made sense, right? It is a non-stigmatizing term for two groups of people, okay? And then I grew up and started to hear the term sexual minorities as an umbrella term. That term was used well into my career as a therapist. There were sexual minority or LGBTQ organizations in Seattle that used the phrase sexual minority for a long time. Then I started to hear gay and lesbian people starting to refer to themselves as gay, men as gay and women as lesbians. Then I started hearing lesbians referring to themselves as gay, and I went along with that too. And I'm not saying I went along with it like, okay, I went along with that. I'm saying, I'm up for it. Let's do this. And I would hear commentary around the changing of these terms, of owning terms, not letting the bigots use that term against you. There's just a lot of advocacy and liberation and cultural change and activism and glory in a lot of the history that I'm giving right here, So at first it was gay. That was not only considered okay to use, but it started to become the preferred term. And homosexual started to go out of favor, not because it's a problematic term, but it was just not the term that people felt like they wanted to use for themselves, Then later on, queer started to be used for gay people. And then, and this is just my observation, then queer people started to be used for any LGBTQIA person, right? You could be queer regarding sexual orientation. You could be queer regarding gender, sexuality in general, that sort of thing. So I would see those shifts over time. And again, was absolutely willingly going along with it and adopting and trying to understand and have empathy and all the things. But just to give you a little rundown on my observation of the change, because as a therapist, it's very important that we understand this language, and it's in the literature. You will see clinical research literature that will use language to identify groups of people, and it becomes noticeable, right? Whereas if you're not in a social science field, you might not notice the incremental changes. So there's that. Also, as a professor at Antioch University, which at least in the past, I don't know so much anymore, maybe they still do, but in the past, we really differentiated ourselves from other programs in that we were on the cutting edge of social justice. So it was very important to us to practice what we preached, and a big part of that was I should say a component of that is being up to date on the terminology. And I remember there was, my dogs are barking, before LGBTQIA, there was GLB for gay, lesbians, and bisexual people. And that was, originally it was gay and lesbian. Then originally it was homosexual. Then it was gay and lesbian. Then it was gay, lesbian, bisexual. Then it was GBL. Then it was, in my memory, GLBT for trans people. Then they switched the L and the G because it was, I think, considered sexist to put men first. So that's when it went from LGBT, then LGBTQ, QIA plus, right? Because plus is like, well, there's people that aren't included that should be included. So that is a brief history on that. Then I started hearing people say LGBTQ and not QIA plus, and then I heard people just using the word queer. And today, in the early part of 2025, I will hear and I will read in the clinical literature LGBTQ or LGBTQIA plus, or I'll see queer. The reason why I want to go over these examples before going into psychology terms is that it shows how things change over time. It also shows that there could be people at a previous era in these shifts who is using that term, but we would look back on them today and say, well, they're being insensitive or bigoted or something. But they might not only be not bigoted, but they might actually be at the cutting edge of empathy and consideration and social justice. They might not be, but they might be. The other thing that it illuminates is the extremely complicated nature as to why these things change. And when these things are supposedly acceptable, who are they acceptable to? Like, for example, the Latinx term. I saw a similar progression over the last 15, 20 years from Hispanic to Latino to Latino, Latina to Latinx. All the while, I have friends of mine, like Humberto, co-host on this podcast, who continues to use the term Hispanic. And there was even an episode where I don't exactly know what the context was, but the topic came up or the label came up, and I was reading an email or I said Latinx or something, and my Hispanic, he's born in Colombia, and he says, Latinx? What's that? And I said, and I gave a brief explanation, and he's like, oh, okay, I didn't know. So who decided on that, and is that quote unquote legitimate Maybe it's at the cutting edge. Maybe 20 years from now, Umberto will himself use the term Latinx. I don't know. So it's social construction at play and political movements at play, meaning and all that stuff. So it's complicated is the thing. And that's the back. That doesn't mean we don't do it, but it means that we need to be knowledgeable of the conversation that is happening. Like apparently there were people that thought of homosexual as being a slur, I think because there were bigots who would use it in that way. Oh, he's a homosexual, that kind of thing. But that's not what I heard. Maybe I don't, in the 90s or in the 2000s, early the aughts, maybe I didn't hang around in those circles, which I could imagine, and just didn't hear that way. Because there are people today, when they hear the word homosexual, they will cringe. Oh, oof, God, what a horrible word. And similarly, that in the 90s, there were black people that were telling me that the term black made them feel bad. And I thought, oh, okay, well, that's not my experience. And if it's not my experience, it's not my experience, right? But in these different groups of people, there will be, they're not a monolith, right? Every group has lots of people in it. And even in the Asian community, there's still people that would call themselves Oriental. So these are complicated. And that doesn't mean we avoid it. It doesn't mean that we don't participate. It doesn't mean that we yell at each other. It just means that, we have these conversations. And when it comes to psychology terms, a very similar conversation needs to happen. So let's get to different psychology terms. The first one that I want to talk about, so this is all the mini rabbit hole that I did today based on this Asperger's email. And the other term that I hear being criticized sometimes is the term histrionic. So a very brief history. Listen to my whole deep dive on histrionic personality disorder. But in the ancient history in Egypt, like 4,000 years ago plus, we are under the belief, or historians have enough evidence to conclude that there were physicians or healers of that time in ancient Egypt who would be treating women who had a variety of ailments. And as with anything in medicine back then, it was all it's very strange to us, the way that they would diagnose and treat and that kind of thing. And this was another example of that. They had thought that women were suffering from, I can't remember exact symptoms that they were identifying, but they thought that the women were suffering from a wandering uterus. And listen to my whole deep dive on histrionic personality disorder, because I go over a lot of this. But they would try to coax the uterus back to where it should reside, which is in the crotch region. I'm not a physician, so I don't know the terms. They would try to coax the uterus back and stop its wandering by putting smelly things in the woman's crotch, or putting nice smelling things. I read that for a time, because we're talking about thousands of years here. Well, the ancient Greeks, 2,500 years ago, were very much enamored with ancient Egypt, right? Because the Egyptians to the ancient Greek people were like these wise, old, ancient people. So the ancient Greece adopted a lot of Egyptian ancient notions, this idea of the wandering uterus being part of it. This is all coming back to histrionic personality disorder, which is still in the DSM and still the language that I use today. That for the Greeks, they had a word for uterus, which was hyster, I think, like hysterectomy, right? And they found a similar ailment, or it's very complicated. It's hard to know exactly what the physicians were seeing. And it seemed to be kind of a catch-all for a lot of things that women experienced. And they thought, well, the ancient Egyptians knew this thing about the wandering uterus, and so we're just going to adopt that, and we're just going to call it uterus syndrome, which they would say hysteria or histrionic, or I can't remember the full term in Greek, but it was hyster-based. And when you read the symptoms of this disorder or this syndrome or this medical condition, it's very amorphous because, they just didn't have the kind of scientific rigor that we do today, or they saw things differently. Anyway, so then the ancient Greek notions get passed down, particularly in Europe, and there's a whole history there, and it is morphing over time. But the term hyster or hysteria is continuing to be used. Then, by the time psychology and psychoanalysis starts to come around in its infancy in the 1800s, you have this term hysteria that was not just associated with women at this point, and had a completely different set of symptoms, and had a lot of what we would think of today as a cobbling together of probably literally 15 different disorders. Again, listen to my whole detail on histrionic. And Freud, his very first publication with his mentor, Joseph Breuer, was about hysteria. The title has hysteria in it. I have the book behind me. I'm not going to look it up. I forget it. But anyway, it's a very important book, obviously, because it basically is the foundation, the beginnings of psychotherapy and of everything that I'm telling you today. There's a lot of silly notions in it because they were the first people to even begin to think about talk therapy, because it is such a bizarre thing. It still is to a lot of people. But anyway, so maybe it's just called On Hysteria. Anyway, and it would have been in a different language, right? Because anyway, so there's so many tangents. By this point in 1880, when this book is published, there's this notion that hysteria is a psychological problem, not a problem with the uterus, that it's not just women, but it was used as, anything in medicine was used in a sexist way, in that when it's carried out, when it is assessed, that kind of thing, it appeared to be practiced in a sexist way, although the concept of hysteria was not inherently sexist, but it was used in a sexist way. And it had a little bit of sexism baked into it a little bit. Anyway, so then hysteria starts to evolve and morph over time in these tiny little iterations. And by the time we get to the mid-20th century, things start to look more like the way we think today. And these personality disorders started to be identified. They, as a community in psychology, started to formalize the criteria and differentiate between different kinds of personality disorders. And hysteria or histrionic personality disorder started to become much more narrowly focused and, in my view, a very helpful focus instead of just throwing everything in. Because just to give you a short talk on this, the 1880s hysteria, not just by Freud and Breuer, but a lot of people, Charcot, blah, 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 it's a whole history, but that they basically saw half of what humans can suffer from psychologically to be considered hysteria. Now, there's all this terminology later on, like being hysterical, right, as a way of talking about laughter. Also hysterical as, oh, there's a woman over there, she's hysterical again. So these are all bastardizations of the term. The term didn't start, it's not like Freud was like, oh, there's women being hysterical. It was a serious clinical word that they were trying to seriously use. It, by culture, starts to be misunderstood. It's sort of like gaslighting is a serious term. The public catches wind of it, they misunderstand it, and they over-apply it, and it starts to become used in a very different way. And when we see gaslighting in the clinical literature, we have to divorce it from the way society is using it. Well, that's another thing to think about before moving forward, which I'll get to in a second. But with histrionic personality disorder in the mid-20th century, they started to find that there were people that actually seemed to fit into this group. And research has demonstrated that over time. And today in 2025, we have a pretty rich, specific understanding of what we would call a histrionic personality disorder. So, isn't it weird that in the DSM and myself, we will use the term histrionic when it goes all the way back to the ancient Egyptians, believing that women had wandering uteruses, that uteri that would cause all sorts of problems. Okay, and there's this whole history of that term or that label or that diagnosis being used in a sexist way, even going back to the ancient Greeks. There's evidence that they were using it in a sexist way, that women or young women or teenage girls were, in a similar way, the Salem witch trials were suffering from what society or physicians would identify as some kind of medical problem or psychological problem, however they framed it. But there's a possibility that the young women either were very upset about the traumas and the oppression that they were going through, and they just weren't complying with society in the way that they were supposed to, and then they're just labeled as, it's hard to tell, obviously, exactly what's happening. But there's that. Now, has the label of histrionic personality disorder, has it been used in a sexist way? Absolutely, because we live in a sexist society, and psychology emerges out of our society, and so it's going to be sexist. And we see that in the research, actually. Like, when it comes to people that will present with what we call cluster B personality disorders, whether, especially if we don't think antisocial, but we think about narcissism, histrionic, and borderline, these people are, these disorders are considered to be in the same cluster, right? I kind of have a little bit of a problem with that, but if we go with it, one of the aspects that I can go along with is that people that I will assess pretty confidently after 6 to 12 months of evaluation, because it can take that long to really zero in on something when it comes to a personality disorder, that when I will diagnose someone with having histrionic personality disorder, for example, for the first few months that I see them, not all the time, but I might initially think borderline or narcissistic, and then later delineate or zero in on histrionic, or vice versa. So all three of these disorders can sometimes, not always, present in a way that is in between or confusing for one or the other. And so what research finds is that, and this is a number of studies, that they would take actual patients who have been diagnosed with, say, borderline, and they will write them up and then take away the gender. So the research participant, the clinician, doesn't know the gender of the patient. And then they will have this other clinician evaluate and speculate as to what the diagnosis should be. And what they will find is that a lot of women who have been labeled as borderline, if you take out the knowledge that they're a woman, a different evaluator will label them oftentimes as narcissistic. So what that tells us is that for evaluators, for diagnosticians, for clinicians, that if we get someone that's sort of in between narcissism and borderline, one of the delineating factors, so it was a woman, oh, it's borderline, oh, it's a man, it's narcissistic. Does that make sense? So some research seems to suggest that the prevalence regarding gender and narcissism and borderline is not 2/3, 1/3, is much more close, if not exactly 50-50. It's hard to know, though, because these constructs are, to some extent, kind of amorphous. And if you ask 10 clinicians to diagnose the same person, you're going to get some different answers. So it's not like a scientific delineation, but I think it does illuminate how these things can be gender biased, right? And with histrionic, it has a very similar history. The construct itself, it says nothing about gender at all, but it can be very much used in a sexist way, not only in the way that I just said earlier in terms of bias, misapplication, or another scenario is that, let's say someone is like 25% on the histrionic spectrum, and if they're a woman, they'll be diagnosed with it, and if they're a man, they won't be. You know what I mean? Which isn't necessarily oppressive or harmful, but is clinically dubious, let's just say. Anyway, but historically, hysteria or histrionic, as with a lot of things in the DSM, can absolutely be used in a sexist way, right? That a woman could be speaking out against injustice at home or in society and label, oh, she's just hysterical, or literally diagnosed as having histrionic personality disorder and institutionalized. This is in the past. So the term histrionic has all that history, and there's a lot of more details to it. Even in our own contemporary times in the last 150 years, there's a lot more detail there. But there are some people in my field who will advocate for changing that for a number of reasons. One, it has to do with the uterus in ancient Egypt, which is funny. Why do we call it histrionic? That's silly. Hyster is still considered to be related to the uterus. So not only is that just like an odd foundation to the term, but also it's inherently sexist, right? Histrionic, hysteria has been used in a very sexist manner, not only in our field, but in the broader society, That woman's so hysterical, she's so emotional, that kind of stuff. But when we use the term, is that shining through whenever we're using the term? Because most people don't know the history. So there's that. Also, even if it does have a racist or a sexist or problematic foundation, does that matter today? It's just a label, it's just a term, right? Now, I do advocate at times for changing these labels because, like with anxiety, the word an anxiety disorder, generalized anxiety disorder, you use that term with the general public, most people would be able to guess as to at least what the area is in terms of what it's referring to. Major depressive disorder, right? That these sorts of terms are self-evident to some extent. Well, histrionic, borderline, these terms are convoluted and have a weird history. And I didn't really even know the history of these terms until I started doing deep dives on this podcast 15 years ago. To have these words changed might be a good idea. And I've been advocating for that, not strongly, but if the label could better reflect the condition, that might help all of us, including clinicians, because a lot of clinicians do not understand personality disorders very well. And I was thinking of different terms we could rename histrionic, and one term that I thought of, I think I even thought about this in a previous episode years ago, of something like attention deprivation disorder. So you could argue that the primary trauma of people with histrionic is that they were deprived of attention when they were very, very young, 0 to 3, this kind of thing, and adapted neurologically and characterologically to amp up unconsciously their attention-seeking behavior because it was the only way to get attunement or a little bit of attunement and possibly to get safety. And it becomes fixed in their personality, and they distort things through that if they're not getting attention, a lot of attention, then they will feel very afraid and very hurt when other people with more typical attention-getting early childhoods would not interpret it that way. And their inner life and their behavior can harm them and make their lives very difficult. So, to describe that in a label or to point to that, attention deficit, right? or deprivation, sorry. Attention deficit would obviously can be confused with ADHD, but attention deprivation, deprived of attention, or attention seeking disorder, which has its own negative connotation, right? And me even just saying that might shock some people. It's like, what? Are you calling histrionic people like drama queens or something? No, I'm describing it the way that I described it. With borderline, I think I've proposed a change to the term betrayal trauma disorder, or just betrayal trauma personality or something, because that's the central, or abandonment / betrayal trauma disorder, personality disorder. With narcissistic personality disorder, I thought of the term today of neglect trauma / defensive narcissism disorder, or NTD&D. I think that would describe it, right? Neglect trauma, defensive narcissism disorder. Maybe if we use that term, the public wouldn't misunderstand it. You talk about narcissistic personality disorder, all anyone hears in society apparently is self-centeredness and lack of empathy, lack of other-centered or other noticing, right? And yeah, it's a very narrow part of it and a complete lack of understanding of where it comes from. But anyway, all right, let's take another break, or back from the break. So I want to be clear that the labels of histrionic and borderline, I'm okay with. When I first learned of these terms, I had no idea where they came from, and I just thought of them as that's the string of letters and the sounds that you use to describe this thing. And it was more about the thing than the label that we put to it, right? And that's still how I operate as a clinician, that when I am treating someone with borderline personality disorder, I don't think of them as borderline. I think of them as them, and that term is just a placeholder for a very specific way of applying it to an individual person. If you were to ask me to conceptualize a particular individual, the word borderline might not ever leave my mouth. I might not ever say the word borderline. I might describe what, if you were to say, okay, how do you describe that in one word? I'd say, well, this area of the conceptualization over here, I guess you could label as borderline personality disorder, but everyone is different that has borderline, and to understand the foundation and the way it manifests and the way it's processed and the way it interacts with culture and gender and themselves is really what the conceptualization is. So I don't really care about. Now, if you want to know the origins of the word borderline, that I actually kind of stand by. There are a lot of people that say it should change because it's stigmatizing. I don't think it's inherently stigmatizing. It's used to stigmatize, primarily by clinicians, by the way, because the general public doesn't really have an association with borderline. Some do, but most don't. The vast majority, or I don't know, anecdotally, a lot of clinicians, when they think of borderline, they think of a very cartoonish, extreme, weird version of borderline, and might even just label it's so borderline, that kind of, and that's a problem, right? And should we change the term because of those assholes? Maybe, but that shouldn't be the primary reason, right? One, because if we just change the term, the stigma follows. And it's a very ham-fisted, simplistic way of trying to correct for something, right? What we should do is get rid of the stigma, right? That's what we should attack, not just change the word. And I find that it will relieve people who don't really want to do the work or don't know how to do the work to change the word. Because to them, people in power, because to them it feels like, oh, okay, I fixed it. We're no longer calling it borderline. We're now calling it this other thing. There's no more problem. I don't have to deal with the attacks. Let's move forward. But that doesn't fix anything. The stigma is still there, or the sexism is still there. And it just evades, or it just takes a while for the stigma to catch up or the bigotry to catch up to the word, and then the assholes continue to use that word in that way, and we're right back to where we started. So we should be attacking. Now, sometimes changing the word is important because the foundation, were a lot of people that were going or referring to Fort Benning, the military fort in the South, that were going there. Were they all racist, or were they like, yeah, this is a slave? Most people who referred to it probably didn't even know who it was really named after. I'm sure some did know who it was named after, but many probably didn't. But with borderline, the history of it is that there were a group of people, patients, who were being documented and treated in the early part of the 20th century that were being talked about as being within one particular area. And what they found was that this group of people presented it as somewhat psychotic, meaning they were delusional. They had a break from reality. They had delusions. They believed things that were obviously not true or were demonstrated to be not true. So, for example, you'd have one person, let's just say they weren't borderline. This individual suffered from psychosis, and they come in and they think that the FBI is after them, that sort of thing. But they don't say it that way. What they say is, and I've had patients like this, they'll say like, oh, it's really my life, my life has a lot of stress in it, and this is just a, hypothetical. Oh, okay. And then I ask, what's going on? They're like, oh, my wife, she's really abusive to me. Oh, tell me more. And he says, well, she has been really, really verbally abusive to me lately. Oh, okay. What's happening? That sounds awful. He says, well, when she thinks I can't hear, she will whisper extremely horrible things about me. I'm actually right now talking about like 10 clients that I've worked with that have this specific delusion, and it manifests in a variety of different ways. And then he says, yeah, what does she say? Oh, well, when I'm in front of her and she's talking direct, we have eye contact and whatnot, she acts normal. But as soon as she leaves the room, like she goes to the bathroom or something, I can hear her saying really horrific things, like that she wants to kill me and that she thinks I'm a complete idiot and that I'm worthless. And I've heard her say this, I've heard her say that. And, at first you're, whoa, that is horrible, right? But then the schizophrenia or whatever psychotic disorder, it progresses, and you realize, oh, looking back, that was an early stage, or maybe even that sustains over time, and it's just a low-grade delusional disorder. But anyway, point is that it will be categorized as, oh, that individual in all likelihood was reporting to me a delusion because it was a part of the overall persecutory voices that they were hearing that sometimes are applied to other people. Anyway, so that was observed. Psychosis was pretty obvious and was easy to detect in early psychology, and so there was a lot of research and a lot of knowledge around people who suffered from these sorts of delusions. Then there were people that would come in that presented with what looked to be psychosis at first. The way that they described the close people was similar to that subtype of delusion. They believed they had very negative interpretations of the people that were around them, that the clinician suspected or could confirm in all likelihood was a vast, a very gross exaggeration of the scenario. And so, oh, okay, well, this person is delusional. But then over time, it looked like this group of patients were not delusional in the way that the people suffering from schizophrenia were. The delusion never went beyond close attachment figures or people that were close, other humans, and the quote-unquote delusion always seemed to be in the category of misinterpreting the other person as being overly hurtful, abandoning and betraying, when that wasn't really happening. So it's this really narrow delusion. And so among the researchers and the clinicians and the authors and the theorists and the leaders, they started to socially construct this conceptualization and then a label for that. And this is pre-DSM, so this is pre-formalized diagnosing. It's just a language that early psychologists and psychotherapists and psychoanalysts would use. And they would say, this individual is borderline delusional. They're not delusional, and there were a lot of people that were included. Either, in all likelihood, it's a type of people were included in this. But anyway, so they were just in this. There were delusional people, and then there were borderline delusional people. Over time, this became more formalized, more researched, more case examples, more experience. By the mid-50s, you have this label called borderline personality. And then it was formalized in the DSM, adopted by the authors of the DSM as borderline personality disorder. And they tried to systematize it, by the consensus of experts in this area. And it, has lasted till today. It's been refined over time. There's been a lot of research on it. But the word borderline has that origin. Some people consider that to be offensive. It doesn't, the people that I know with borderline personality do not, even if they understand that origin, I don't know anyone personally who considers it to be offensive. It's interesting. And again, I wouldn't mind changing it because it doesn't describe it. Borderline to what exact? And even if you know borderline to delusion, that's not helpful. It's not very descriptive. A much more helpful label to me would be abandonment trauma syndrome, or abandonment trauma, if we need something for the DSM, abandonment trauma personality disorder, abandonment/betrayal trauma personality disorder. But I say all that because there are those for a long time who have been trying to change the term borderline, and this is just my opinion. And I think a lot of people are trying to change it because of the stigma. Instead of attacking the stigma, they just want to change the word, which again, if they do, I'm all for it if it's more descriptive, right? But there are others that just want to get rid of the whole construct altogether, which I think is really silly because we need some way of talking about this sort of thing. Anyway, so another disorder that I want to talk about that has actually been changed because of the movement to change it is conversion disorder. So conversion disorder, in a nutshell, and this is just my way of describing it, other people might have a problem with this, is that when humans of various cultures around the world, it seems, according to research and anecdotal self-report, that when people are going through significant psychological distress, and particularly if they don't have a way to get help for it, they can sometimes manifest the psychological distress in a physical symptom, like blindness or paralysis or something along those lines. And what Freud originally called it was that they were converting their psychological distress into a physical somatic symptom, in a nutshell. So it's called, eventually in the mid-50s in the DSM, it would be called conversion disorder. Okay. So in all the versions of the DSM, up until DSM-5 in 2013, that was the label, conversion disorder. But then they changed it to something, which I'll get in a second. And the movement to change it, to me, my opinion, was misguided. This is one of those, now it's not a horrible thing, but it's kind of a useless thing because I don't know a single person who uses the new term. Everyone I know, and even in a lot of the clinical literature published still in 2025, they're still using the term conversion disorder, even though in the DSM, they don't use that term anymore. There's a different term. Now, sometimes that's necessary, like multiple personality, dissociative identity disorder. I kind of get that. And so, well, it's not different personalities, it's different alters. And I don't know, to some extent, it's like, well, how do you define personalities, right? But okay, and I'm not like lying awake at night lamenting these things. But with conversion disorder, it's just a good example. Now, am I upset about this? No. But it just gives an example of how I think the movement to change a term can be misguided or listened to too much by clinicians or researchers or authors, of the DSM. Anyway, so the arguments to change it away from conversion disorder was that it was considered to be too psychoanalytic because it comes from Freud, because he was the one who coined the term. Because it's converting, and Freud had a complicated way of talking about it in his system of, libido and id and catharsis and all this kind of stuff. But in a nutshell, it's converting psychological distress into a physical symptom. And to me, that model or that way of thinking, that metaphor, because it's not really converting. It's not like you have a factory inside of your soul that converts something to something else. But I find it to be a very helpful metaphor and a helpful label to identify that metaphor. Converting. Okay. But there were people, no, we got to change that because it's too psychoanalytic. And, Freud and psychoanalysis has been proven to be outdated and silly and not supported by science. And when people say that, I just think you have a cartoon, simplistic version of Freudian theory or psychoanalysis. There's so much to it, and there are still a lot of things that most people consider to be just givens, like the concept of the unconscious, not necessarily invented by Freud, but certainly formalized and spread by Freud and his followers. But anyway, this notion that because a term is related to Freud, it should be changed based on that is silly, because there are so many words that are coined by Freud, because he was a very prolific author for, maybe 50, 60 years. And he was the first. So whatever word he used, the followers would use that word, because it's like, well, that's what we're all reading, and so let's just use that word because that's the word that I learned in school or whatever. So let's just continue. That doesn't mean we don't change it, but I just think that this criticism of it being Freudian is silly. I mean, think about the word histrionic. That goes, it is kind of Freudian. He didn't coin it, but he popularized it. And anyway, but there's a lot of words. I was trying to think of all the different words that we use that are from Freud directly. Even the term unconscious, the unconscious, defense mechanism, repression, suppression. And some of these words, a few of these words were developed or coined by his students or even his own daughter, Anna Freud. Transference, countertransference, projection, displacement, identifying with the abuser or aggressor, sublimation, denial, reaction formation, regression, libido, resistance, id, ego, superego, and many, many more. There's probably 100 other terms. And so we're not supposed to use any source. Now, what they're talking about is the DSM, which is like the official Bible, so to speak. And they're not saying don't use these words, but we shouldn't have them in the DSM. I don't know. They also, this is, I think, a key here, is that the criticizers who won, by the way, they managed to get it changed in the DSM-5, is that they thought that conversion disorder was dismissive and stigmatizing. And I would say, well, yeah, to the dismissive stigmatizers, conversion disorder is dismissive and stigmatizing, but it's not essentially, the same way that borderline is used as a dismissive stigmatizer. The term isn't that way, and probably the vast majority of clinicians and experts and researchers that are using terms like borderline or conversion disorder are not thinking of it as a stigmatized term and are not using it as a stigmatized term. So, it's really silly. Because if we do this with, well, I'll get to that in a second. The other thing that the advocates for changing it and who ultimately won is that they thought conversion disorder was sexist, which is completely bizarre to me because, yeah, any disorder, as I've been talking about, probably literally every label in the DSM has been used in a sexist way, in addition to being used as a heterosexist way or a a classist way or a racist way. Does that mean we literally every time something is used by the oppressor, any term, any word, we change it as a way to fix the problem that never gets fixed? You know what I mean? To me, that is just bizarre because I've never thought, and no expert in conversion disorder would consider conversion disorder to be inherently what is the accusation is that it's inherently a woman's disorder. And even if that were true, which is not in my circle or in any of the circles that I am aware of, but even if that were true, what would changing the name fucking do? You know, that doesn't take away the sexism. It just changes the way the word that's used in the action of sexism. Anyway, so that's pretty silly. Now, there's one argument that they made that I agree with. So the term that they changed it to is functional neurological disorder. So functional, if you don't know in the field, is, at least from my awareness, because it's mainly a medical term, but we can use it in our field as well. It delineates between functional and structural. So if you have a structural problem, and there's a lot of Venn diagram-y kind of overlap and nuance to this, but if you have, for example, let's say you have numbness in your left arm. If it's a structural problem, then you have some sort of measurable, identifiable nerve problem, right? Or some other problem that could cause that. You take an X-ray and you see that the vertebra are impinging on the nerve, which is causing numbness in the left arm. So that's a structural problem. A functional problem is one that seemingly doesn't have a physical thing you can point to as to why it's happening. But it's still happening and it's still physical, right? It's not all in your head is the thing. So there's actually something wrong, and they might still be able to measure it to some extent. Like if you had numbness in your left arm and they're like, it's functional, it's not structural. They might be able to take measurements of certain markers of signals in the nerve and find that actually the nerve is not firing normally. So something's different there, but we can't point to anything structural as to why that is happening. Okay. And sometimes, at least from my understanding, is that they'll say, well, it's functional, but that might mean that we just don't have the technology or the ability to measure as to what the structure is exactly that's causing the problem. So we just have this word called functional because the structure looks okay as far as we can tell, but there's a function that's happening that is a problem. Okay. So I'm not a physician, but I know enough about this, and in psychology we have some awareness of this and use it anyway. But so in the DSM, which is a psychological manual of disorders, we have this word functional, so I thought I should point that out. So we have this functional neurological disorder. So the thing that I can get behind is that this emphasizes that there's a real problem in the nervous system when you have a conversion disorder. What people will say is that conversion disorder, so conversion disorder is sometimes thought of as people, when they use psychosomatic is the term that some lay people will use, meaning that it's all in your head, right? Your headache or your numbness or your blindness, it's psychosomatic. And there's a whole history on the term. The term isn't a problem so much as the way it's used or the way it's thought of. People say, it's all in your head. And then people will feel dismissed, right? They'll be like, it's not all in my head. I literally cannot feel in my arm, or I'm literally blind. It's not all in my head. Okay, so let me delineate here. On one hand, it could be used to dismiss people as being hysterical, that they're overreacting or faking. But at the very least, if they just relaxed and decided that they didn't have numbness, or if they just tried to reduce their stress a little bit by relaxing, the symptom would go away. Or by saying it's all in your head, they are saying you're doing this to yourself on purpose, or you're too weak to push back, or something. There's a lot of weird notions in there. Okay, so that is stigmatizing and stupid and wrong. But another way of saying it's all in your head is that it's all in your head. That when, or not, and not in your head, but in what we would metaphorically call in your head, in that it is in your distress neurological system. It's not in your head, it's throughout your body. But when we think of emotional distress, right? Like if you are going through grief, or you're worried about society, or you just went through a divorce, that doesn't, in terms of the way we language this, it doesn't physically impact your body, right? But you're having all these physical symptoms. So how do we call it? What do we call that, right? And to me, when someone says, well, it's all in your head, that could be dismissive, but it could also be a recognition of it's all in your head. That's important. It's in your emotional head, in your very real head that has real neurons that is reacting in a very real human way. So to try to divorce ourselves from it's all in your head, to me, is trying to divorce from the foundation of these disorders as to how we see it. We can never know if these things are actually happening, right? Because there's no physical marker of converting distress to a functional neurological problem. For example, you can even have people who say, a man's wife dies and suddenly he goes blind, and then he goes through a lot of therapy and he gets his sight back. Well, that could be coincidence. He could have had something that is undetectable that just happened to him and went away. It just coincided with the grief and the recovery. So we can't know, but there's enough data to suggest that this is an actual human phenomenon. And it's not hard to imagine, given that when all of us are stressed out, we will have some kind of physical symptom in all likelihood, whether we recognize it or not, right? It's not known if those physical symptoms are related to the distress, but it happens enough times that it's hard to ignore. Anyway, so if you have a big amount of distress, then it makes sense you might have a big amount of physical symptoms. Also, it seems that across different people and different groups of people, especially when you consider around the world, those people or those groups of people who don't have emotional talking outlets tend to exhibit more conversion symptoms. Like one way of thinking about even our own society is that in the past, it's hard to know prevalence because it's hard to survey the entire population, and our constructs change over time. But it seems as though today in mainstream American society that conversion disorder has much less prevalence than in the past. Well, possibly it's because in today's society, in mainstream American society, people are able to talk about their feelings more than they were 100 years ago, that kind of stuff. And compared to around the world, right? Anyway, not that we're the best at it, but I think you get what I'm saying. Anyway, so when it comes to the change to functional neurological disorder, that aspect of it, at least in part, I agree with that. It is important to recognize as clinicians that this is a very physical thing that's happening to someone. And the distinction between physical and psychological is ridiculous. It's all physical. The psychology is physically happening. And all things psychological are physical phenomena, including any sort of somatic symptom that can result from the very physical thing of psychology. Anyway, so in the DSM-5, it's now called functional neurological disorder, but I've never heard anyone use that term. It's 12 years later, everyone still uses conversion disorder. All right, so another term I want to talk about is mental retardation. So in the mid-1800s, and some of you probably know this, there were terms for what we would call today intellectual disability that were words like idiot and imbecile. And it's hard to know exactly the way that the culture saw these words, but they were much less culturally laced. As you call someone an idiot or an imbecile today, that means a particular thing, right? But in the mid 1800s, it wasn't as much of an insult, right? It still had problematic foundations because in the mid 1800s, psychology was in its infancy, and it was still very much in that way of thinking that people are weak or not as worthy of human beings, and so it's all kind of infused there. But by the then there's this early phase of psychology, early 1900s. There's a whole history here of eugenics and Nazis, even in the United States, and psychology and intelligence testing and capitalism and industrialism, and it gets interesting. But the term for intellectual disability starts to become formalized based on IQ testing as it existed in the early 1900s, with particularly low IQ people being called idiots, and then a step up from that, they were called imbeciles, and a step up from that, they're called morons. Then, in the mid-20th century, there was this huge movement to move beyond a lot of that and make things more scientific. There was a lot of federal funding that was going, because of World War II and what we call now post-traumatic stress disorder, and also a desire to delineate during World War II soldiers who were fit for war. There's just a lot of interest by federal dollars and tax dollars being spent on research, and for a lot of reasons. But one of it had to do with the effort of psychiatry to categorize things, and also blah, blah, blah. And so there was also this movement of trying to make things not stigmatized anymore. And so the people, psychology got together and said, okay, what word are we going to, and there'd been already a movement up until this point. But as the first DSM and other kinds of important works start to be formalized, this term emerges of mental retardation. And at the time, that phrase was used as a social justice phrase. No longer, this is what they would say, no longer are we going to call them idiots or morons or imbeciles. One, because the foundation of those words is problematic, and two, they've definitely become problematic in recent times by the general society because they're starting to use the clinical term as an insult among themselves. So let's get away from that. We'll call it mental retardation. They certainly aren't going to use that term in a denigrating way, haha. And there were a lot of terms that were brainstormed. How they got to mental retardation was that it essentially meant that they were trying to get to the observation of the individuals, getting away from labeling the person as a thing. They wanted to observe behavior and say, this person shows this. And the thing they were pointing to was that these people show slower learning. It takes them longer to learn than their age group would learn, right? Whether it's math or language or science or whatever, or how to tie their shoes, that it takes a little longer. So retardation, retard meaning slower. So they're slower. Now, even the word slower or slow would later be used in a insulting, bigoted way. You're slow, right? But originally it was just an observation of how long it would take to learn. Now, even that observation has problems with it, but generally speaking, I stand behind, at the time anyway, what they were coming out of in terms of what they were trying to do. Well, then my generation comes along, Gen X, and we start using the term as an insult. Call people retarded or a retard. I remember that growing up. And so that becomes bastardized and used in a bigoted way. We could say bigoted or insulting, stigmatizing way. So for a long time, though, these were in parallel. When I was early career in the 90s, a lot of clinicians still use the term mental retardation. And I heard that's what I stepped into, right? I would hear people using it. I probably even heard people using it clinically in the 80s and whatnot. And I also heard people, lay people, using that as an insult. All right. So in the 90s, I had both of those awarenesses that in some contexts, retardation was non-stigmatizing and even compassionate as a word. It was trying to show that they were observing behavior or, you know what I'm saying. And then another part of me that was aware in another context that it would be used in an insulting, stigmatizing way. Okay. There was another word growing up, actually, and I've asked people in other communities if they had this, but they didn't, in that I think this was a special, a bigoted word just in my school. I'm not even sure. But they would call people speds, meaning special ed. And it meant the same thing as calling someone a retard. And I thought that it was just a word that everyone used, but you know, I don't know, 20, 30 years later, I would remember the word and I'd ask people, they're like, I didn't. Stacy, my wife, grew up across town, and I can't remember if she said she used it or not. But anyway, point is that there were a lot of words that were being used and still are, right? To this day, in 2025, you'll see people on Twitter calling people retards and stuff like that. And that's awful. It's stigmatizing. It's horrific. It's immoral. It's wrong. It's hurtful. It's horrific. Anyway, so then there was a movement to change the terminology away from mental retardation because for new clinicians and younger clinicians, younger people in the field and in society, they would react to that term as if it was inherently stigmatizing. But it's not inherently stigmatizing. It's been used in a stigmatizing way. And also, clients would see it on their assessment form, or a parent would see that on a medical record for their own child. And since they have a limited understanding of the term, it felt hurtful. So there was a movement to change it, which, again, I'm not saying it's good or bad. I think it could have been worthy at that time to say, let's address the stigma, not the word. And changing the word is not going to change the stigma. And changing the word is just going to kick the ball down the road. Having said that, since I came up during this time of switching the word, I'm okay with it because I was there while it was happening. But anyway, so today, in 2025, it's intellectual disability. To me, that term feels a little funny to me for reasons I can't really describe. I could try to describe it, but to me, intellectual disability feels a little bit more stigmatizing than mental retardation. But that's just because linguistically, in my generation, where I came up in my cultural pocket, those are the associations that I have. It's sort of like getting back to the queer word that I grew up for, maybe the first 30 years of my life, where queer was a really horrible thing to say, that even bigots behind closed doors might not use that word. There's certain words where you're just like, whoa, like okay, like the C word to be sexist, right? That there are many sexist people that would not use that word. So, well, I'm not going to go that far. Queer was that way growing up for me. It was just like, oh, no. Like, now, I've adjusted, my brain has adjusted, but there's still like a 1% of me that's, when I hear queer, I'm like, ooh, like, oh, that's right. And so mental retardation to me, another word, and I talk about this all the time, is the word moist. For what I grew up the first 35 years of my life without anyone associating moist with anything other than just what it describes. Usually it's like moist cake. You really want your cake, your birthday cake, to be moist, or I don't know, a dish that comes out of the dishwasher is moist. I don't know. Over the last 20 years, people have decided the word moist is disgusting or sexual or something. And I don't have that. I've since internalized that. And now when I hear someone use the word moist, because it's usually in those contexts, I have that kind of feeling. But I remember the change, right? And so that doesn't mean that it's bad, though, right? I'm not going to be an Issaquah Indians, proponent. I think there's literally a Facebook page dedicated to Issaquah Indians forever, and I'm just like, grow up, get a life. There's other things in life. And also, like, do you understand that what white people or what, non-Native Americans, non-Indians, non-American Indians, what they have done to getting back to that term. I'm just going to use the term Indian because all the Indians, Native Americans I know, that's at least of the terms that they use, will use Indian. The point is like, do you know how many atrocities have been and still are happening to Indian people, American Indian people? And there's that background plot, because what proponents of this, with fighting Irish, right? What's the big deal? Well, we could actually kind of go down a road of how horrible the Irish people were treated, not only in the United States, but in Great Britain, right? So, well, not Great Britain, but whatever you want to, the Isles, I forget the difference. It's like England and Great Britain and UK and I don't know. You know what I'm saying? So, anyway, what was I talking about? Oh, just the changing words. So I'm okay with intellectual disability. I've been okay since the very beginning of its shift. It's fine. But I say all this because what we really obviously want to do is attack the stigma. We want to push back on that. We want to get the bigots and the jerk faces to not be that way. How do we do that? Do we just change the word? Because there are still people calling people retards. It didn't change that. And they're still basically saying what they were originally saying. Us changing our language didn't change anything. I guess it just changed it so that when we are labeling someone, the lay people don't misunderstand that we're insulting the person, I guess. But if you call if someone on their medical record, it says intellectual disability, the public will still stigmatize that. That doesn't change anything, okay? And in another 25 years, I'm going to take a guess and say that intellectual disability will be considered to be a horrible term because of the ongoing stigma. 30 years from now, if someone comes across this episode, they'll be like, I can't believe Kirk used the term intellectual disability. What a bigot he is. So what's my point? Yeah. My point is stigma against Asian Americans or non-white people, against people with intellectual disabilities, against the notion that it's all in your head, meaning that it's a choice that you're making. That's the thing we need to attack. The retention of the label borderline, to me, it's just like, look, bigots, or even clinicians who are using the term borderline as a cudgel, as a way to dismiss someone. This is just me personally. That's a good example because I wouldn't be surprised if in 30 years, borderline will be named something else. And me today, at least 99% of me is just like, let's go after the problem in the clinical world that misunderstands borderline and uses it as a cudgel and has no support or education or supervision around that issue. You know, a lot of clinicians are walking around having borderline clients and they have no idea what they're doing because they've never been helped about what to do. Let's address that. Just changing the word isn't going to do shit. Having said all that, sometimes changing the word is doing shit. Changing Fort Benning to Fort Liberty, I can't remember what it's called, but because there's dozens of these forts that have been renamed. Changing those forts is great. Changing Issaquah Indians to Issaquah Eagles, thumbs up. Changing some of these high school names to a different, yes. What are the other words that we were going over? Maybe changing histrionic, right? I mean, to something that's more sensical. I'm okay with. Partially because in my field, not a lot of people even know what histrionic is. So, because part of the reason why you don't want to change the term is that when you change the term, it confuses everybody. You know, there's a transition time. Like for the first 10 years of because it was right at the beginning of switching it to dissociative identity disorder. There was a period of time where for a number of clinicians, you know, older clinicians, if you use the term dissociative identity disorder, they'd be like, huh? So, you know, there's confusion. And also in the clinical literature, someone today in graduate school, if they read something from before and they have older terminology, the contemporary student won't know what they're referring to, even though it's just a different word. That doesn't mean we don't change it. It just means that, you know, it can lead to confusion, particularly if we change the term over and over again. You know what I mean? So getting back to Asperger's, that one, when I think about the big picture, makes total sense to me. I mean, not only a Nazi physician, but a Nazi physician that was responsible for, because it wasn't just him, but it was a movement and a policy and an organization, a national organization that was rounding up and imprisoning and exterminating and killing people on the autism spectrum. So to have the label named after him is hurtful. It's not, you know, people say offensive or problematic. You could see that hurting someone's feelings. And it would be hurtful to say, right? For those people that knew the history, right? Now, and if we explain it that way to people, they'll be like, oh, okay. But if we just blast them, like the way some people will do, instead of showing the work and leading them down the road, believing in other humans to have empathy and compassion, because they typically will, that they'll come to the conclusions, but you don't, anyway, you get my point. But I appreciate Jana from Estonia emailing in and saying, hey, I heard either me or Bob use the term Asperger, and is saying, don't use that term because of these reasons. I totally appreciate that and enjoy that. And it prompted me to do this little deep dive. And I'm sure I bothered nobody in this episode. I don't know, maybe sometimes I think I'm going to bother people, and then it seems either the people who were bothered never emailed me or commented or anything, or I literally just didn't really bother people. Sometimes what I hope it happens is that if there was an opportunity to hurt or bother or offend or something, that my long-windedness either put you to sleep before you got offended or provides enough context to explain at least where I'm coming from. You know what I mean? But I don't know. Let me know what you think. And everyone take a deep breath. You know, even if you're not of any of the groups, which would be hard to imagine that I've talked about today, all of this is referring to two big important areas in our lives. One is just the knowledge of oppression or having experienced oppression and bigotry ourselves. But even just the knowledge, the awareness that bigotry has and is occurring is distressing to us because we're humans and we care. So that requires a big, deep breath for that. And to say, we're all on the same page here. We're all working on it. Let's keep doing it. There we go. The other big area is that in all likelihood, you've either been worried or been accused of committing a political correctness crime of some sort, whether it was for the right reasons or the wrong reasons. And there's obviously a lot of anxiety about that and maybe a lot of pain. I guess as a third category is, in all likelihood, all of us here have been microaggressed or macroaggressed upon in some of these and related ways, whether it was being called a slur or being stigmatized because we have borderline or something. There's a lot of hurt and a lot of misunderstanding. If someone crashes into your car and you have whiplash and you go to work and you describe it, people in all likelihood immediately understand and can show compassion. You talk about a microaggression or you tell a coworker, I don't prefer that you use that term. It's so complicated and there's so much baggage to it that it's so frustrating. It's so hard to understand and to articulate ourselves and to describe. So yeah, all that to say is take a deep breath. We're all in this together. Let's focus on love, listening, understanding, speaking up, advocating for ourselves, giving others the benefit of the doubt because we all deserve it. We really, really do.